So we've examined trauma related to road traffic collisions, and I want to just explore now trauma injuries globally and as a burden of health. An estimated 5 million people worldwide died from injuries in 2000. That's a mortality rate of 83.7 per 100,000 population, and this has only increased, and we can see from the projections towards 2015 trauma as a cause of death, as a cause of morbidity, will increase. And why is this? Why are we not targeting it and reducing it in the same context that we are for maternal health and NCDs? Injuries accounted for about 9% of the world's deaths in 2000 and 12% of the world's burden of disease, particularly road traffic injuries, but also violence, war, and self-inflicted injuries, and these are expected to rise dramatically towards 2015 and onwards. More than 90% of the world's deaths from injuries occur in low and middle income countries, and we've explored many of the reasons for this, and we'll continue to examine this over the next few sessions. Injuries are a neglected epidemic in developing countries, and almost one that is people are blinded to in a sense. It'd be interesting to think as to why. Why is trauma not seen as in the same light as an NCD or in the same light as maternal health? As I mentioned, they cause more than 5 million deaths, and this is roughly equal and overtaking the number of deaths from HIV, AIDS, malaria, and TB combined. If you look at the graph, you can see the projected course of injuries and deaths from particularly road traffic accidents, and this is only going to increase by 2020. Data on the number of people survive. That's due to data collection, that's due to recognition of trauma as a cause, that's due to reporting. We have very well developed systems for reporting HIV, for malaria, for outbreaks, for epidemics, and we see this routinely being exercised throughout the world, both in development but also in disasters. We don't have the same reporting system for trauma, and perhaps we need to address this. So why do more than 90% of deaths occur in low and middle income countries? Well, it's multifactorial, and if we use road traffic collisions as an example, we can see that the approach to managing trauma from road traffic collisions starts with economy, starts with education, starts with improving road conditions, providing vehicle maintenance, educating population on road safety and looking at road safety strategies that can be implemented, but the same will exist for reducing trauma from violence, from conflict, from burns, from household injuries. There are many, many, many factors which affect death and injury, not just the event itself. And we need to start by determining these factors and instigating changes towards improving them. Preventative measures are often non-existent. Healthcare systems are very poorly prepared often to meet that challenge. That is not just the health facility itself, but the resources it has, the skilled labourers, skilled clinicians it has, and the ability for ongoing care and definitive surgical care, particularly in trauma cases. We looked at the socio-economic impact of maternal health, and this was huge, and the same really exists for injury as well. The socio-economic impact of injury-related disability is magnified in low-income countries because of those factors we've spoken about. Poorly developed trauma care, poorly developed rehabilitation systems and ongoing care, and little or no social welfare infrastructure. Why, though? Why has the importance of preventing and treating injuries yet to be embraced by the global public health community? And there's no real answer to this. It's worth having your own thoughts, documenting perhaps some of them in your learning journal. But why is this such a factor? What is the challenge and the limitations to generating evidence, generating research, and then responding to the evidence and research to try and reduce trauma from injuries and reduce mortality. I mentioned that research is limited and it's underfunded. How much money is donated in comparison to perhaps a malaria program or TB program or maternal health program, which is dedicated towards reducing trauma or improving trauma care? There's insufficient resources allocated globally. However, if this was targeted, better treatment of injuries would help achieve 3 of the UN Millennium Development Goals: reducing child mortality, improving maternal health, and promoting gender equality in respect to access of healthcare. I think we've seen this graph earlier in the session, but you can see the distribution of global injury mortality by cause. Now this is from the year 2000, but this will be very, very similar for now, and obviously the projection towards 2015. As you can see, road traffic injuries, 25% of all causes of mortality, followed by self-inflicted violence, interpersonal violence, so things like domestic violence, again commonly seen in Western environments, but also in less economically developed countries as well. Poisoning, falls, fires, drowning, common occurrences in low and middle income countries, many of which are preventable deaths. We're going to just now explore 5 different areas very briefly, just to give you an idea of the occurrence and prevalence of injuries relating to different types of trauma. These are going to be burns, violent trauma, gender-based violence, which we spoke a little bit about in maternal health, conflict-related trauma, and accidental injury. When we look at these different categories of trauma-related injury and death, we also need to understand the burden of disease on dailies lost. When we explore these other causes of trauma and injury, we also need to look at it from the disability-adjusted life years effect. And this is a measure of overall disease burden expressed as the number of years lost due to ill health, disability, or early death. And trauma significantly contributes to dailies. You can see by this graph, which shows global injury-related mortality rates by cause and sex, again data from 2000, but a very similar projection for 2014 and 2015. And you can see that generally the highest population affected by trauma are men. And again, road traffic injuries particularly causing the highest mortality rate in men. Why is this? Well, many factors. Are men the most likely to be out and about on the roads, driving, walking, going to work each day? Women, are they generally more likely to be based at the home and less likely to be driving a vehicle or pedestrians? Fires, on the other hand, has a greater mortality rate amongst women, and again we can relate that to lifestyle and community setup within low and middle income countries. It is more likely that women are going to be at the home, providing for the family in terms of cooking, and therefore be more exposed to the risk of fires. So burns account for a huge amount of injury and trauma, and I saw a large amount in northern Sri Lanka, some self-inflicted, some due to the community and domestic setup within the village, and devastating because the availability of care within the health facility for the availability of skilled workers to manage burns is very limited, and burns itself requires ongoing lengthy rehabilitation. There's high risk of infection, there's high risk of contractures, and it's a very difficult injury to manage, not only in developed countries, but particularly in low and middle income countries. You can see the graph here that shows the global fire-related burn mortality throughout the world, and the mortality rate is greatest in parts of Africa particularly, and again in the low-income countries. Southeast Asia accounts for just over one-half the total number of fire-related burn deaths worldwide, and as I mentioned, females are particularly at risk, particularly in the countries of the Southeast Asia region, and have the highest fire-related burn mortality rates worldwide. We can see that the population it particularly affects those younger, so the 15 to 29-year-olds, who are most likely to be engaged in activities relating to fire, particularly cooking, particularly amongst the females. So violence, and this includes both self-inflicted violence and perhaps violence from conflict, but 95% of homicides occurred in the low and middle income countries. And again, reflective on the map, you can see that a high number occurring in Central and Southern Americas and Africa. Poor accidents. Well, safety standards vary dramatically across the world, and in high-income countries we can see the presence of a high level of safety standards, the need, for example, to wear hard hats when on a construction sites, to go undergo health and safety training, to wear fluorescent jackets, and many, many, many more types of standards exist. In low and middle income countries, however, we rarely see this. You can drive across a low income country and rarely see any construction worker or road worker wearing a high fluorescent jacket to identify them or a hard hat, particularly on building sites. And this exists again for agricultural work, particularly in building construction and lots of other elements. And therefore, there's a much higher risk of accidents occurring and a person being affected. Once the accident occurs, they're fed into a system which doesn't necessarily have the resources to manage that type of accident, both in the acute phase but also in the ongoing and rehabilitation phase. This table shows the world rankings of injury-related mortality and burden of disease, particularly in dailies lost, which we spoke about slightly earlier in this presentation, and projections for 2020. We can see that the number of deaths from road traffic injuries is going to become greater. It's going to move to the 6th highest in the world of injury-related mortality and burden of disease by 2020, and 3rd in the world for dailies lost. The same is going to occur with self-inflicted injuries, interpersonal violence, and injuries from war. So this is an increasing burden of disease around the world.